evening. I'm your host, Shamika Rhymes, and welcome to Soulibration. Let me know where you are watching from and how you're doing this evening. I already see Asheville checking in. Welcome. Remember to share this with your network because you never know who may need to see it or who's been thinking about what we're talking about tonight. And if you have any questions at all tonight, drop it in the chat because you guys are the co-hosts. So tonight we are talking about breast reduction surgery. And it's a procedure that can ease pain, improve posture, and help people finally feel comfortable in their bodies. And I mentioned last week that I had breast reduction surgery back in July. So look, y'all, I got on a button-up shirt. Anyway, we'll get into the questions that people have been asking me and that I've seen online, which are, how is size determined? What recovery looks like? What to expect with drains? Especially they want to know about the scars, the pain, and the healing process. Hello, Gastonia. I see you. And we'll also talk about liposuction, sensation changes, and how reductions differ from mastectomies because this is Breast Cancer Awareness Month. So I'm excited about tonight's guest. Dr. Julia Stevenson is a board-certified plastic and reconstructive surgeon and the founder of Cardinal Plastic Surgery. So let's bring on Dr. Stevenson.
Hello. How are you doing?
Hi. Good to see you again.
Good to see you too.
So Dr. Stevenson and I go way back to seeing eye to eye earlier this summer.
A few months ago.
Yes, before my surgery. So I thought
you were getting ready for it.
Yeah, so she's the perfect person to come and talk about it because she calmed me down before my surgery. Talk me off the ledge.
Yes.
So can you explain what a breast reduction actually is and how it differs from, augmentation that we always hear people talking about and a breast lift?
So I always like to start off because there's always these misconceptions about plastic surgery. People use cosmetic surgery interchangeably.
Yeah.
And so the best way for me to divide the specialty of plastic surgery is cosmetic surgery and reconstructive surgery. And the easiest way to differentiate those is insurance will cover or approves of reconstructive surgery. Mm-hmm. Cosmetic surgery, they do not. So you can very well have a breast reduction that's labeled cosmetic because your insurance just didn't approve it. Mm-hmm. So those are kind of like the nuances. So I always like to start off with that because a lot of people use those terms interchangeably. Mm-hmm. And also when we talk about reconstructive versus cosmetic, reconstructive is to bring things back to things within a norm. So cosmetic surgery, probably the common thing people might think about are nose surgeries. So rhinoplasties mm-hmm. or nose jobs, where anatomically it's within the spectrum of normal. It's mm-hmm. just you don't like the hump or something like that. You don't have something functionally wrong. So when we talk about the difference between breast reduction and a breast augmentation, mm-hmm. you just don't like the size, they're too small and you want to add something to it. Mm-hmm. That's where we get into functional issues.
Yes.
And the improvements that you're trying to make. Mm-hmm. Breast reduction, a lot of times patients, again, if you're reducing your breast size, they're large. Mm-hmm. They very well may be affecting your activities of daily living. So you might be experiencing neck pain, back pain, shoulder pain, rashes underneath, odor, all that kind of stuff. That's not normal.
Right.
But for insurance to cover it, you have to make the case that it is affecting your life. Mm-hmm. And keeping you from doing things that, if they were smaller and you didn't have neck pain, back pain, shoulder pain, it would really help for them to be made smaller and reduced. So if we're talking about the difference between a breast reduction and breast augmentation is you just don't like the size. You'd like to be normal, you'd like to be larger, but there's not any functional problems that you're having.
Okay. Yeah, you just brought back unlocked a memory of the long list that the insurance company gave I guess, the doctor that I went to, and it was like a checklist of things of what you had to do to get insurance to cover it. And all those things you mentioned about the shoulder pain, the neck pain, the back pain, all of it. And miraculously, I haven't had any of that.
Breast reduction patients are the happiest patients.
Yes. Yes.
Yeah. Because it's a quality of life issue that's been improved significantly.
And I'm curious, for those in the chat, have you had a breast reduction? And if so, how did it go? Or are you thinking about it? So I've had this question a lot. So some of these questions I'm bringing to you come from TikTok, and because I started talking about my experience over there, and so people have been messaging me.
Yes.
So people were asking, does a breast lift or is a breast lift included in a reduction, or is that considered a separate procedure? Because I've seen a lot of people talking about their mommy makeovers on the summer. So,
that's fine. You're hearing it from the people.
Right. Yes. So, plus I had nothing else to do.
So the difference between a breast lift and a breast reduction is a breast reduction, you're focusing on removing enough volume to help with that neck pain, back pain, shoulder pain, rashes. For patients that do not want so much breast tissue removed that makes them smaller than they want to be, and they don't meet criteria for insurance, technically that's a breast lift.
Oh.
That's if we're talking about like the specifics when you talk about insurance coverage versus not. Insurance is saying, well, it's not a reduction because they don't meet the amount that we expect for you to take off based off of their height and weight, their BMI. Makes sense that taking off this amount of tissue will help their neck, back, and shoulder pain. Okay. From a plastic surgery standpoint, the difference between a breast reduction and a breast lift, breast reduction, again, you're more focused on removing the volume and the weight. Yes, a lift is already incorporated into a breast reduction.
Yes.
With the breast lift, you just more have saggy, hangy breasts. If you were to cup your breast, you're happy with the volume. You just wish they were lifted. So you're really not focused on removing volume. You're just wanting to literally lift it. The example I try to, particularly with like the mommy makeover patient, trying to determine if they're wanting more volume taken off versus just a lift, like they're happy with their volume. I usually try to make the comparison of a tube sock with sand in it.
Oh,
okay.
Okay.
Tube sock is the skin of the breast. 2 cups of sand in it is the breast tissue. So with the breast reduction, you're not only removing tube sock, but you're also removing sand. With the breast lift, you know, like when you're trying to put knee highs or stockings on and you scrunch it up?
Yeah.
The breast lift is just removing tube sock because you're just trying to tighten it so that that sand that's in there now looks a lot more full and lifted, and you bring it back up on the chest where you wanted it to be.
Okay.
So it's 2 kind of different focuses, but a lift is already incorporated into a breast reduction.
See, I don't think I knew that. So when I took my ace bandage off after day 3, I was like, they up there.
The girls will be up.
They are up.
Because a lot of the times with patients with large breasts, the nipple is now below the fold underneath their breasts. Your nipple should be at that level or a little bit above. So I usually like to draw a picture for patients that kind of show this is where your nipple and your breast size is now, and this is where it's going to be. So you can see just how much lifted it's going to be.
I did a comparison on a t-shirt, a white t-shirt, saw it on YouTube with how it looked before. And then I drew, I should have brought that to show the difference, but I wasn't thinking about it. So you mentioned like BMI. I'm just curious. does that play a part in whether or not insurance will cover it? Because I know on the checklist of insurance things, it was, have you tried to lose weight? What measures have you tried
Right.
to take? Have you had a nutritionist or,
Right.
been in a program, all those things. So does BMI play a huge part?
So this is the sticky part of this conversation, because
Yeah.
I do tend to do breast reductions on patients with higher BMIs compared to some of my peers. So the thought process behind BMI and your breast size, your breasts are made up of fat and gland. Okay. The gland is the mammary gland, which produces milk. It's a lot more dense and heavy than fat.
Okay.
And we all have our friends who, if we gain or lose weight, they'll tell you, girl, I lose it in my chest first, or that's the last thing where I lose it. And so when you talk about weight fluctuations, one of the questions we ask is, if you lose weight, do you notice it going in your breasts first or no? And sometimes that's an indication of if you have more fat in your breast versus gland.
Oh.
So yes, if you have more fatty breast tissue and you lose weight, then the size of your breasts will decrease. The problem with that being a criteria for breast reduction is that young patients tend to have a lot more dense breast tissue where it is just all gland. No exercise that's going to help them lose that.
Yeah.
So them telling you to lose weight or to get down to a certain BMI, you're not going to notice a difference anyway. Also, a lot of the times patients can't do the things that would help them lose weight because of their neck, back, shoulder pain, breast size, and they can't find bras or support garments that support them enough. So that's the correlation with BMI and the breast reduction criteria. Going along with that is they use a chart. Every insurance company uses a chart based off of something similar to BMI, but it's your body surface area, but they still use your height and your weight to calculate that. And based off of your body surface area, they approximate how much breast tissue the plastic surgeon needs to remove for this to be considered medically necessary.
Okay.
You have to meet a certain amount based off of your body surface area. So not just a BMI criteria of, if you've got a BMI of 30, which I rarely have patients with a BMI of 30. My kind of cutoff is about like a 38, 35 for like cosmetic procedures, but a 38 for insurance based. Because again, people are like in pain. Most of the times in patients after pictures, they've lost weight because now they're actually able to do the things that they've been wanting to do. But the BMI being a criteria just for them meeting it, but then also it being the gauge of how much breast tissue insurance is requiring being taken off for it to be considered medically necessary.
Okay. So that brings me to the next question of how you determine what cup size. So I'm going to be transparent, y'all, as usual. I was a 38G when I walked in there. I don't know what I am now because still swollen and still healing. But how do you decide? Because I know the doctor asked me, he said, what size do you want to be? And I was like, I don't even know the sizes anymore because I haven't seen them in so long.
Yeah. So I always start off, we ask, what your current cup size is. And again, everybody has this image in their mind of what they think they're going to look like afterwards. So can you share that image with me? And I see people along the full spectrum of, they've always been large breasted. So like, I want to be smaller, but I don't want to be flat chested because I've always had breasts.
Right.
Or some are like, listen, I'm done with this. My back is killing me. I'm like as small as you can make them. And then I'll say like, no, but seriously, like you actually don't care how flat you are. And they're like, no, I just don't want to have to deal with this anymore.
Mm-hmm.
So that's where it's really important that you feel heard by your
Yeah.
surgeon, that they're actually wanting to know what you want,
Mm-hmm.
because that's the purpose of a consultation.
Right. Yeah.
What are your goals? And based off of what your goals are, what your current size is, and knowing insurance criteria, can we meet, like, is that something that's doable, or do we have to compromise somewhere?
Mm-hmm.
Okay. So that's the first thing I ask patients of, how small do you want to be? And the example I use is a C cup.
Mm-hmm.
For cup size, there unfortunately is no like 12 inches equal a foot.
Right.
A cup size is different on everybody.
Mm-hmm.
But to me, a C cup is proportional to your body. So you're not
That's,
top
yeah.
heavy and you're not flat chested.
Mm-hmm.
It's perfect. You're not tipping over. Everything is even top and bottom.
Mm-hmm.
If that's a C cup, where you want to be. And
Yeah.
most patients are usually like C cup.
Mm-hmm.
Again, I've had patients that are like, take it away. Because I'm
Yeah.
done with this. I literally don't care.
Mm-hmm.
But having said that, I've definitely had patients that have seen me, for a second opinion, and they weren't asked that. It was just, this is the size you're going to be for us to meet insurance criteria.
Wow.
So that's why I'm saying it's really important for you to feel heard.
Yeah.
Because some surgeons will take off whatever insurance said,
Mm-hmm.
and patients aren't aware that that's what their end result's going to be. It's one thing if I tell you, for insurance to cover this, I'd need to take off this much, and that's going to put you smaller than what you wanted to be. Are you okay with that?
Mm-hmm.
And some patients are like, yeah, that's fine. But you got to have that conversation.
Right. Yeah.
And sometimes I've had patients where it's like, even if I tried, I don't think I'd be able to take off that much. Because if I do, you're going to be flat chested. Like you're not going to be happy.
Mm-hmm.
That's when we have that conversation of, we can do the self-pay where I can cater this more towards what you're wanting.
Mm-hmm.
It's still a breast reduction, but it's
Right.
not covered by insurance.
Right.
You see what I mean?
Yeah.
So, but it's really important that you feel heard and that you
Mm-hmm.
actually ask, so you're not just going to take off that amount.
Mm-hmm.
Is that if you take off that amount, am I going to be smaller than I want to be? If that's the case, I don't want to do that then.
Right. Yeah. That's why I think it's important to go on a couple consultations, like you said, when some come to you, it's the second. Because my first one, I asked him, what size are you thinking? And he said, I don't go by cup size. And I felt like he
You would have
didn't
been
even want to
upset.
have the conversation. And so the next consultation, he's like, I think a C would be proportionate. And I said, okay, but if you can get it to a B, I'm cool with that too. But a C is good. I just want to be proportionate.
Right.
Because I wasn't before. And
Right.
so that was my goal, was to be proportionate, but I might not have gotten there if I hadn't have seen someone else for another consultation.
Right. And also just to see each person's approach, because again, a consultation is an interview.
It is. Yes.
You have to feel comfortable with the surgeon, and the surgeon, same way, has to feel comfortable that they can meet your goals and your expectations.
Mm-hmm. Yeah.
Everybody thinks it's just like either like a one-way street where I'm here for a breast reduction, this is what I want, or vice versa. You came to my office, this is what I'm going to do. It's a relationship.
Mm-hmm.
Because you always have to think worst case scenario. If something bad happens and I got to be in this person's office every week, am I going to be upset?
That part.
that I like can't stand this person. Like I actually don't think they care about me.
Yeah.
Yeah.
Yeah. Yeah, exactly. That's how I felt about my first consultation. I was like, I don't like his energy, his attitude, the way he
Yeah.
looks. I felt like Kendrick Lamar, the way he looks, the way he talks, all the things.
Yeah. And, and especially when it comes to surgery, it's you hope for the best, but
Hmm.
you prepare for if there's complications. Because in complication, not, the serious stuff, but even just like wound healing issues,
Yeah.
infection, like
Hmm.
those are just like the small inconveniences that people don't anticipate having, or like,
Yeah.
well, you didn't tell me this was going to happen. Those are just the things that kind of come along with surgery.
Hmm.
And I always give the example of, everybody expects their baby to come out with 10 fingers and 10 toes. There's always little things that can happen.
Yeah.
And if you don't feel comfortable with the person that's giving you care,
Hmm.
don't do it.
Yeah.
Do not
Yeah.
do it. Seek
Yeah.
seek a second opinion, third opinion.
I want to remind the chat, if you guys have questions, please drop them in the chat. Now, I did want to touch on this since October is Breast Cancer Awareness Month.
Mm.
How does everything we talked about, I know it differs heavily from a mastectomy for those that are dealing with breast cancer.
Yeah.
Can you talk a little bit about that process? I know we talked about the reduction, the lift, the augmentation, but can you talk about a mastectomy?
Yeah, so a mastectomy is removing breast tissue to varying degrees to help surgically treat breast cancer.
Hmm.
So I'm going to go back to breast reduction really quickly. So with the breast tissue that's taken out, we send that to pathology to make sure there's nothing crazy in it.
Yeah.
Because you can, have your mammogram beforehand and not see anything. Send the breast tissue for breast reduction to make sure there's no, abnormalities, things that could turn into breast cancer. Um, but a mastectomy is where you are actually removing breast tissue to help, again, surgically treat breast cancer. So
Hmm.
whether that is just a lumpectomy, where you are taking out the area of breast cancer with a healthy margin,
Hmm.
where you're trying to conserve as much of your breast as possible, where there's some patients are like, no, if I can keep as much of my breast as possible, I just want to do that. That's a lumpectomy. But a mastectomy is where you're actually taking out all of the breast tissue and leaving the skin and fat. Maybe or maybe not keeping your nipple. That depends
Hmm.
based off of the size of your breast cancer, the location of it. If it's close to your nipple, then it may not be safe to keep it because you can have, tiny bits of breast cancer that may be along close to that nipple. Um, and then follow that up with reconstruction.
Hmm.
So there are, again, just like we're talking about, there's varying degrees of like breast lift, breast reduction.
Hmm.
There are different things that may be options if you have been diagnosed with breast cancer to help treat it. There's a surgical portion, and then you can have radiation therapy, chemotherapy, and then also hormone therapy to go along with that surgery.
Okay. Okay. Um, so I want to go back to breast reduction for a second. Because I had people ask me this and I was like, wait, now I'm gotten myself confused because they were asking, which procedure did your doctor do? Lollipop or anchor? And I was like, I don't know the difference. You told me, but
Yeah.
I don't remember.
So I'll be honest again again, a lollipop, I would say that's more like a breast lift technique because again,
Hmm.
you're not focused on taking off so much breast tissue. It's usually going to be that anchor or inverted T incision where you have a scar around your areola.
Hmm.
And from there you have that lollipop portion, but then you have the scar that follows the fold underneath the breast, so it looks like an anchor.
Hmm.
Again, especially for large breasted patients, that's going to be the one that gives you the best chance of getting the kind of reduction you need. If
Hmm.
you're doing a lollipop, it's only because you needed to lift the nipple,
Ah,
not decrease the size and the shape and everything. Yeah.
Okay. Now, what about the scars that go? Because my scars go all the way under the arms.
Yeah, go all the way back. It just depends. Again, different breast
Yeah.
sizes, especially with very large breasts that are hanging. A lot of people can have that fold that goes almost back to their back. And
Yeah.
that's because the skin is pulling. And so to try to capture all of that, because again, once you reduce it, it's not hanging that way anymore. It's going to be up. And so you have to make sure you capture all of that skin so that you get a better closure.
Oh, okay. So to throw another little procedure in there because I had that done too. Lipo. So like I
Yeah.
had lipo done. I guess it was the wings right here, and then
Yeah.
along the sides.
Yeah.
So can you talk about when is that appropriate? Because there wasn't something that we mentioned it in my post op. Oh, not post op,
Mhm.
pre op, and he's like, "Well, we could do that," and I was like, "Is it extra?"
Yeah, I
But
mean,
yeah. So.
they're definitely, I think the whole surgery needs to be considered because again, if it's just breast reduction,
Mhm.
there are times where, there are patients that can have the breast tissue that's like right here
Yeah.
underneath your armpit that can be liposuctioned out.
Mhm.
There can be some tissue that you're not going to quite take out with that scar coming back underneath the arms,
Mhm.
to help thin that out a bit to
Yeah.
reduce that bulk. So it kind of depends on like the overall, like what areas, because again, everybody's different.
Yeah. Yeah.
Everybody's body is different. And how things look on one person's skin integrity.
Mhm.
I could do the same surgery on somebody that looks like they have the same breasts. And it can look different just because of how either thin the skin is or the density of the breast tissue. So there's
Mhm.
a lot of things to consider with the liposuctioning. And again, if what they're liposuctioning.
Okay.
Because again, I've had patients that are like, well, what about like it goes to the back? That's not the breast. That's not the breast.
Right.
It's not a breast reduction. I mean, if you want to do a back lift, because we literally have to turn you over, there's no
Okay.
way to get all the way back here
Yeah.
without like you have to be on your back for us to do
Mhm.
it because that's a back lift.
Okay.
So it
Okay.
just, if people bring those things up, it's like, okay, but that's not a breast
Mhm.
reduction. Your insurance is not going to cover that. We can give you a quote for upper back lift so that all that stuff is done together and
Mhm.
you have a nice smooth contour. So that's what I'm
Mhm.
saying. It kind of depends on what other things are going on,
Okay.
with the clinical situation.
Gotcha.
Yeah.
So, a lot of questions have been about drains. I did not have drains for my reduction.
Yeah.
When is it? Is it just the surgeon's choice whether or not you have a drain or not?
It is. I don't use drains either. There have been a few instances where I have, but that's few and far between.
Mm-hmm.
And what I've found, because I want to say when I was in training, one of the plastic surgeons used drains. And it's like they only leave it in for like a day or two, and it's just a pain for patients. And it
Mm-hmm.
really hasn't necessarily been shown to be effective. It's just annoying. So the times that I have put them in, though, it's on patients that have more of the fatty breast tissue,
Okay.
not the dense breast tissue.
Ah.
Because also, so after a patient goes to sleep, but before I actually start removing breast tissue, I actually use the same fluid that we use for liposuctioning, to put it into the breast tissue to help with pain control and bleeding.
Mm-hmm.
And it looks like water. And so, depending on a patient's tissue or breast makeup, sometimes it's a lot more like wet, um,
Mm-hmm.
even at the end of the surgery. And if that's the case, I may put a drain in.
Oh,
Um,
okay.
but a lot of the times it's already either, been absorbed or it's already drained out. So,
Oh, okay.
and sometimes
Okay.
it is physician or surgeon preference.
So
Yeah.
of course, people have been asking about pain level after the
Mhm.
surgery.
Mhm.
I
Mhm.
feel like for me, it was mostly the nerve pain,
Mhm.
and the itching. Itching was the worst.
Yeah. Yeah. Everybody always, sometimes will complain about itching, but like, but that means it's healing, right? So there's different types of itching, and for different reasons. So sometimes people can be having allergic reaction to like the prep we use. Did you have that?
I was
Yes, like
the
sometimes,
worst. It was the tape. It was the tape.
or the
Like,
tape. That
yeah.
was the other thing I was going to say. Either the prep or the tape
Mhm.
that we use, like the steri strips. So if you have an
Yeah.
adhesive allergy,
Mhm.
it's always important to let your surgeon know. I apologize if you can hear my dog
That's
bark.
okay. That's okay. But you may
Um,
not know you have an allergy. Like I didn't know until until then.
yeah, no. And sometimes it's not just the adhesive. There
Mhm.
is another fluid we use to help that steri strip stay on, and sometimes it can be that.
Mm.
So prep the adhesive from the steri strips. And then, after you remove the steri strips and you realize it's not that anymore, then there's that healing itching.
Yeah.
But then there is, particularly with patients of color, always concerned about like keloids and those types of
Mhm.
things. People can have, and it's not necessarily an allergy to the suture, like the dissolvable suture. It's
Mhm.
just your body, the healing process and the way in which dissolvable suture dissolve is an inflammatory process. So if you have prolonged inflammation, you
Mhm.
get like a little bit thicker scars. They're not keloids,
Mhm.
but if your body's like, I'm tired of these suture that are in here, and they start
Mhm.
kind of spitting them out,
Yes.
it can be prolonged inflammation. And so those scars start to itch. So that's why I say
Oh.
there's like varying degrees of
Mhm.
itching at the various stages of healing. It just depends. And again, communicating with your surgeon of like, where are you having it? Because
Mhm.
sometimes people can have a little bit of thickened scar and they're like, no, it's not itching me. It's not bothering me at all.
Yeah.
Yeah.
Yeah. So I just have a little bit that's thick, but the rest is very thin. It's fine, but it doesn't
Yeah.
itch.
Yeah.
Um, but
Yeah.
the sutures are still spitting.
Yeah.
My
Yeah.
body's like, I'm done.
No, and that's what your body's saying. It's like, I don't want to do this anymore.
I'm like, I
just,
agree.
just get it out. Yeah. And that's really annoying part. And it is hard to know who's going to experience that. Yeah.
Mhm. Of course, people have also been asking about sensation, which actually another question. This kind of goes
Mhm.
along with it too. I know you mentioned with the lift, you're bringing the nipple up. What about the
Mhm.
areola? Is that area decreased as
Mhm.
well? And then the sensation, especially for women that may be wanting to have kids later or have more kids and they want to breastfeed at some point. Can you talk a
Mhm.
little bit about? I guess that's a double question.
Yeah. Okay. So I'll talk about breastfeeding first.
Okay.
So we usually instruct patients that if you have a breast reduction before you've had children, or if you have a breast reduction before you plan on breastfeeding,
Hmm.
because you're not just removing the fat, you're removing gland. And the gland, again, is what gives you the ability to breastfeed.
Hmm.
Your ability to breastfeed may be decreased. Also, with some of the scarring that goes on, too. So, you may be able to breastfeed, but you may
Hmm.
not be able to solely breastfeed.
Gotcha.
I think an interesting conversation that I don't think we have enough is the fact that it's already hard to breastfeed.
Hmm.
You don't have to have had breast surgery to have a difficult time breastfeeding.
Right.
So it's hard to say that it was the breast reduction that may have made it difficult for you to breastfeed. But I always
Hmm.
like to give people that information that, you may be able to, maybe, maybe not.
Mhm.
You probably won't be able to only breastfeed. You'll have to supplement with formula. The
Okay.
sensation talk. So with breast reduction, there's always the risk that the nerve that gives sensation to the nipple can be damaged or cut.
Mhm.
It's not uncommon when people wake up from surgery that they either have decreased or no sensation. Some of that's just because of the numbing medication that was put in.
Mhm.
Nerves don't like to be touched.
Yeah.
They're finicky. They don't, if you touched me, you looked at me wrong, I'm gonna act like I don't know you.
Mhm.
And so you can either have decreased or no sensation for absolutely no reason, and your nerve is fine.
Mhm.
And it just takes maybe, a couple days or like a couple weeks for that nerve sensation to come back. There's a
Okay.
small percentage of patients where it does not come back.
Mhm.
Okay. Probably the thing I see most common in breast reduction patients is that number one, particularly with really, really large breasted patients, they've actually lost nipple sensation and just didn't realize it.
Oh.
So after the breast reduction and all that weight has been taken off of that nerve, it's like when your foot falls asleep and then you change positions and you get the pins and needles.
Mhm.
A lot of the patients that I see have hypersensitive nipples after surgery.
Oh.
And they come in, they're like, my nipples are driving me crazy.
Mhm.
And I just tell them to rub them and that will desensitize them because it's the nerves waking up. But even in patients where I've seen where they've had like that slow return, it can
Mhm.
take to like 6 months for it to come back.
Okay. Okay.
So and again, that's a conversation to have with your surgeon beforehand.
Mhm.
Because if nipple sensation is really, really, really important to you,
Mhm.
knowing what those chances are, and this kind of actually gets us into the conversation about free nipple grafts,
Yes.
because this is something I'm passionate about too, because too often I'm seeing patients, again, and I'm not trying to badmouth my male colleagues, but they literally don't care
Mhm.
and don't really educate patients on if a free nipple graft is going to be done,
Mhm.
what that means, and what to expect. For me and a lot of my other female colleagues, a free nipple graft is an in the operating room decision.
Mhm.
Okay. And so for the audience that doesn't know what a free nipple graft is, so after we've taken off all the breast tissue we're going to take off, we are looking to make sure that that tissue that's remaining and the nipple have good circulation.
Mhm.
That's part of the reason why we can only make you so small.
Right.
That's why it's really important for us to have that conversation. How small are you wanting to go? If you're on that, I want to be as small as possible, I'm sick of it. Okay, then we'll have to do a free nipple graft because
Mhm.
there's no way we're going to be able to keep that circulation intact. Okay. For patients that are like, I want to be made as small as possible, keeping my nipple intact. Okay. Smallest I think I can probably make you, just like you were saying, C,
Yeah.
if you can go to a B, that's good for your surgeon to know what kind
Mhm.
of leeway we have so that we
Right.
make you symmetric.
Mhm.
But a free nipple graft is something where we literally take your nipple and your areola off of your breast and put it back on like a skin graft. So that means the nipple that you've had for however many years you've been alive, it ain't going to be the same one. You won't have sensation.
Mhm.
The nipple won't erect with temperature and sensation. There may
Mhm.
be some color differences. So, like, when you take a scab off too soon and it's pink,
Mhm.
there might be some pink areas, some darker areas. And it just might look a little different compared to the other side.
Mhm.
But for me and a lot of my female colleagues, that is an in the operating room decision. So if we had to do it, it's because we had to do it.
Okay.
There have been a few instances where I have done it, but I had already planned on doing it for those
Mhm.
patients that needed a really, really big reduction. And I've never had to do it as an in the operating room decision.
Mm-hmm.
So that's why it upsets me when I see patients where a free nipple graft was done and it was like, that didn't even need to be done. And I've had young patients who
Mm-hmm.
had breast reductions like in their early 20s. They did a free nipple graft, didn't tell them they wouldn't be able to breastfeed. They have a child and they're devastated because they're
Mm-hmm.
like, I didn't know I wasn't going to be able to breastfeed. So it's really important to have that conversation. Am I going to be having a free nipple graft? Is that absolutely necessary? And again, get a second opinion, get a third opinion.
Mm-hmm.
And again, I really do encourage patients to see surgeons of different sexes because the mentality can be a little different. I really, really encourage that.
Mm-hmm. Yeah, you were the one that told me about the nipple graft, so I could take that question back to ask because he didn't even mention it.
That's what I mean.
Yeah.
And that's even in when I have my consultations with patients, I let them know, listen, I've done breast reductions on patients with larger breasts than yours, and I've never had to do a free nipple graft. So I think I'm not concerned about that for you. And I think we can definitely meet that cup size you're wanting to be without being concerned about that. That's always a part of the conversation.
Yeah.
Always.
Yeah.
That's what I'm saying. If you guys have consultations and that's not being like addressed.
Right. Right.
because the free nipple grafts, even for the patients that are like, I want to be as flat as possible, I prepare them. I'm like, there's going to be a lot of hand holding through this because it's going to be like, wait, what's going on here? Why does it look like that?
Yeah.
There's a process to that free nipple graft healing.
Which brings me to my next question, because I have seen, I didn't know this, that once I took that ace bandage off that he had on there, I had to keep it on for 3 days. I was, this is so ignorant what I'm about to say, but it looked like juice boxes. Like I was like not expecting it to look like juice boxes, but eventually, it does. And I saw other people on TikTok saying the same thing. So I was like, okay, it's not just me. So can you talk about the shape? Like, how long does it take for them to settle into what they're supposed to look like and out of the juice box look?
Yeah, and it depends because again, there are different techniques. So I think, you had mentioned the lollipop and the anchor incision.
Yeah.
But that's just the skin incision. There's actually other techniques when we talk about the circulation origin for the nipple. That's the stuff you guys don't see. So that can have an effect on that appearance that you're seeing when you wake up and you're like, why do I look like my boob's upside down?
Yeah.
And it just takes time for it to settle. No, that's real. So yes, there is the skin incision, which is the scar you see, but there are different techniques based off of the different circulation for the nipple that we may use based off of the amount of breast tissue we're trying to take off, the shape that we're trying to get for you, your skin integrity. Like there's a lot of different factors that go into some of the other techniques we use for that. And it does. Usually immediately people are like, you're like, trust the process. It's going to be okay.
Yeah, I was literally looking like, did he mess up?
Right. I didn't punk you. It will settle. Just like for patients that have had breast augmentations, we're like, why do I feel like they're up in my neck? It will settle.
Yes.
You have to consider we rearranged things on the inside and now your skin has to adjust to it. And we already know skin stretches, so give it time.
Yes.
So usually, when, again, I'm not sure how long after your surgery your surgeon had you come back for your first post-op visit, but
2 weeks.
usually, was it 2 weeks?
Yes.
Yeah, at 2 weeks, things are starting to settle where you're like, okay. But like with that big reveal, when you take everything down and you're getting in the shower for the first time, you're like, now, wait a minute.
It is like a whole mind thing because it's like, I see they're smaller, but they look strange.
This is not what we talked about.
Right, at all.
This was not the picture. Yeah. And that's, and so that actually leads to a really good aspect about breast reduction. It's very emotional.
I was just about to ask about that, the mental and emotional things.
It's extremely emotional. So, I mean, from beginning to end, where again, I say breast reduction patients are the happiest patients. They're excited and nervous going into surgery. And I mean, even from waking people up from anesthesia, they're crying.
Oh,
You're like,
wow.
are you having pain? Like, no, I don't even know why I'm crying. It's for breast surgery in general. It's just there's an emotion around it that people don't even know why, like, they're feeling that way. But then even like in the post-operative period, where people didn't realize the attachment they had to them and what they mean to them as a person, as a woman, as a mother, like there's so many things attached to breasts. And this is part of the reason why I say it's really important for people to at least seek out a woman. I'm not saying that even your experience is even going to be good with a woman, but I highly encourage, if you can, because it's somebody who understands. Okay. And yeah, people will come to office and they'll be like, I didn't realize I was gonna feel this way. Like yeah, like my neck and back feel good, but I didn't realize I was gonna like feel sad. Like there's some patients that really like feel sad. And one of the funny stories I always tell patients, because again, I have the spectrum where some people are like, this was the best thing I ever did.
Yeah.
I had one young patient, she was probably in her early 20s, and she actually came. I usually have people come in 2 weeks after surgery, but she called to come in earlier, like a week after, because she was just like, I don't know what's going on. And I mean, she was in tears in the office, and she was like, I shouldn't have done, this was the worst thing I could have ever done. Like, I don't know why I did this. I mean, she's bawling. And I said, well, everything looks good. I said, but how about this? I said, let me see you next week, for your previously scheduled appointment. Take a look. We'll take your steri strips off and see how things are looking, but everything looks good right now. I'm not concerned about anything. She comes back the next week. She's like, girl, I was tripping. I don't even know. It was the funniest thing. She said, I didn't expect for me to be that emotional. She said, but no, it's a new day. She's like, I love it.
That is too funny.
You just don't recognize the impact that it has on your life.
Yeah.
Whether it's from how you've positively been affected or again, body image.
That's what I was going to bring up, because for me, it's been an issue of, I see they're smaller, but when I look in the mirror, I'm still, because I'm still swollen, but I still see those big breasts. Like I don't see, so it's like the body image or like a body dysmorphia type thing, but other people see it, but I'm like, I don't see it yet.
Yeah.
It's weird. I was like, maybe my mirror's messed up.
No. And okay. So okay, there's good things here. So that's part of the reason why we take before and after pictures.
Yeah. Yeah.
Because I've had patients say, I don't really think you took off much. And when they come back for their 3-month appointment, and I showed them their before and after pictures, they're like, you forget.
Yeah.
You absolutely forget. Because you've been with yourself this whole recovery time through the swelling. You can't tell the differences. Your surgeon may see you like every 2 weeks. So they're like, oh yeah, no, it's definitely gone down. But you're with yourself, like looking.
Right.
And you're like, I'm not seeing a difference. But also, this is part of the reason why I'm really passionate about breast reductions, is because when we think about, particularly for women and people who identify as women, when you hit puberty, that's the first thing that kind of establishes you as like being grown up.
Right.
Like who started wearing a training bra first? That's so foundational to your body image. And so now that that has changed, you're used to seeing yourself a certain way when you look in a mirror, seeing yourself a certain way when you wear clothes, seeing yourself like you knew, with that outfit, this is what I'm going to look like.
Yeah.
And now it's not that. Now it's like, well, I know things are different, but I'm not seeing in my mind, it doesn't match up.
Yeah.
There's so much that that's why I'm really passionate about it, because the fact that insurance makes you jump through all those hoops to even get it covered is ridiculous. And we're talking about so foundational, where I'm sure if a man had to carry 9 pounds of weight in between his legs, he'd be like, oh no, this needs to be covered now.
Right.
No, instead, women are carrying bowling balls on their chest, and you got to prove that it's a problem? That's wild to me.
Yeah.
And then you go see someone and they do whatever and don't tell you you're not going to have nipple sensation, even though it was really important to you. Or did a free nipple graft, even if it wasn't necessary, because you're a woman. These are like, when it comes to healthcare and these kinds of issues, particularly with people who are commonly set aside or dismissed, like that kind of stuff drives me up a wall.
Yeah.
So it's really important to find someone that you feel hears you and is open to answering your questions.
Yes. Yes.
No one should brush you off. Like, surgery is not a small thing. Ever. I love a nervous patient. I love it.
Yeah.
Because it means you have a healthy regard for what you're about to undergo. I love nervous. Give me nervous over like, oh, let's do this. Do you know?
Yeah.
So it's not a small thing.
Yeah. Gosh, this conversation's been so good. But for my last question, because I think I know the answer, but what feeds your soul?
Helping people. Part of the reason why I love plastic surgery is because of how I'm able to help people, and it's almost instant gratification. People let me in on aspects of their lives that they don't even tell their spouses, their partners, things that they've never even admitted to themselves, very sensitive things, and that I'm able to help them into that next chapter. I absolutely love that. And that they share with me how they've been helped. Because again, to keep it consistent with breast reductions, a lot of patients have had large breasts since they were teenagers, and kids are mean. And you're still, even if you're 45, 50, 55, you're still the same person that experienced those things when you were a teenager. So you addressing it even at 50, 60, 65, you are actually reliving some of those things that you experienced. And it's healing. It brings it back. It opens that scab up again, but then it heals you. I love that about what I do. That a lot of people will be like, I didn't realize that was still bothering me. Yeah.
I love that answer.
Yes.
Yeah, I love that answer. And I can tell you are very, very passionate. And so I just thank you for coming on and answering all the questions that I've been getting on TikTok. And we didn't even get to some of them, so you'll have to come back. But
Yes,
yeah,
I'm
how can,
game.
how can people reach out to you if they do have more questions?
Yes. So I am on social media. I have 2 accounts. There's my business account, Cardinal Plastic Surgery, on Instagram. Then there's me, Dr. Julia Stevenson, also on Instagram. If you go to my website, cardinalplasticsurgery.com, you can reach out that way. I've got some webinars that I've done in the past with information about different topics. And I'm somewhat active on social media. I know my social media manager wants me to do better, but but yeah, I'm on Instagram, Facebook. So yeah, you guys can just reach out and meet me that way.
Perfect. Well, everyone, thank you, Dr. Stevenson, for coming on.
Absolutely.
The chat must have been just riveted because I've probably asked all the questions they were wondering. So I took it from them tonight. But for more information on breast reductions, you can head over to blackdoctor.org. There's articles and resources there. And coming up on Soulibration, we're going to still be talking about this healing process, whether it doesn't matter what kind of surgery, because we're going to talk about lymphatic drainage massage next week. And so if you've ever wondered what it is, why so many people swear by it, I mean, I had to go check it out because I was like, again, on TikTok wondering, what is this? And how it kind of supports your overall wellness. You don't want to miss next week's show. So join me Wednesday at 7:00 right here, blackdoctor.org. I hope you all have a soul-filled rest of the week. Thank you, Dr. Stevenson.
Thank you.
Have a good night, everybody.